originally from Nepal and working in Norway. So this work is done with one of my senior colleagues, Suresh Kumar Mukhya. So in this article, we evaluated GPT-4 and GPT-4-Turbo. So basically, we performed the technical evaluation of GPT-4 and GPT-4-Turbo to analyze the reflective response generations by using a Counsel-Chat dataset. So in this work, like I will go through the following outlines. I will begin with the introduction, where I introduce what's reflexive response, the method used, and the results, and the discussion based on the result and the conclusion. Just to let you know that I think I'm only the speaker that is basically focusing on mental health. So if anybody wants to chat after this, let's talk. Talking about reflective response, so it is a communication strategy in which it involves like expressing that whatever the other person is saying, you understood it. So it's kind of summarizing and reflecting that you understood what other person said, and it involves demonstrating empathy. So if you are like giving a reflexive response, you should like at least show certain empathy in the response. And this is a pivotal or an important technique when it comes to mental health. So a lot of psychiatrists as well as the physicians who are working in mental health use this technique to treat the patient. As an example, so here is an example of a reflective response. The person is a patient. Suppose person B is a psychiatrist. So the person is saying that he is having a stressed day with all deadlines, and he feels like he can't handle it anymore. So an example of a reflective response would be, so the person B saying, it sounds like you are overwhelmed by your workload and the pressure of meeting all those deadlines. So here you can see that the person B is kind of summarizing what person A said, as well as showing certain feelings. And similarly, the fourth response after he says exactly it's too much sometimes. Here you see that it's much tough to manage everything alone. So that's kind of a summarization or showing reflective response. So specifically, we try to address these three questions. First is how effective can GPTs be? When I say GPT, I like to talk about GPT-4 and Turbo to generate high quality reflective response. And the second thing is how do the generated response compare in terms of length, variety, richness. And the third thing we analyzed was how does GPT perform in terms of sentiment and emotion. Because when it comes to reflective response, it requires showing certain empathy or positive attitude in the response. That's crucial. So with this focus, so this is like our data. So it's a data that is scraped from Counsel-Chat.com, a solution active forum, where experts provide response to clinical queries. And the data set that we use contains like 10 different columns, and the size was 1383. The count was the mean value of the number of character was 2.94 in question, and in the reference text, which is answer, it was like 1521. And the table shows the summary stat. So what we did was, now moving toward the method that we used. So we basically took the data, and out of the data we took the questions, the question title, the question itself, and the topic, and we provided a context to the GPT, and we also provided that we defined a token size, and we also defined we did multiple experiment, but 0.7 was selected. And then these information was passed to GPT-4, which was the earlier model released by OpenAI, and the response were generated. And then we evaluated these generated response using evaluation metrics, which I will talk after this. And similar technique was applied for GPT-4-Turbo, which is a new model released by OpenAI. So we use their API to generate the response, and the generated response were evaluated. And finally, we did a comparison of the difference between what's the result of GPT-4-Turbo and what's the difference in the GPT, the old GPT. So for the evaluation of the generated response, we used BLEU score and ROUGE scores to analyze the quality of generated text. So BLEU score basically it focuses on the precision, and ROUGE basically focuses on the recall. So these two were used to analyze the quality with respect to the referent text, which is the answer. And additionally, you perform the length analysis and the content analysis, like what are the major words it is generating, the frequency of the words. And the third thing that we performed was sentiment and emotion detections. For that, we used radar from NLTK. And now moving towards the result. The first thing which we measured was BLEU and ROUGE scores. As you can see that, so in GPT-4, you can see that majority of the BLEU score, like the frequency at 0 is too high in comparison to GPT-4-Turbo. So it shows that the n-gram, like no n-gram match when it is 0. But in case of GPT-4-Turbo, you can see that it's kind of a more distributed. So it shows that the quality was better in case of GPT-4-Turbo, when it is compared to GPT. And when you compare ROUGE scores, you can see that ROUGE 1, 2, 3, in all the three cases, GPT-4-Turbo was performing better. So it has it shows like better results for unigram, bigram, and trigram tests. And talking about the length of generated response. So the blue is kind of a reference response length, and the orange is the generated response length. So this is also kind of affected by the token size which we define. However, when we analyze the generated content by the both models, in the Turbo model's response, we saw that it generated more contextually relevant, as well as the wording was kind of a possessive. So the response were kind of a possessive, whereas in case of GPT-4, it was more like nuanced, and they were using more empathetic words. So in general, we found that the response of GPT were more empathetic than the Turbo. And the another thing that we performed was we performed the sentiment analysis, and the sentiment analysis showed that in case of GPT, which is the first one, it has overall sentiment score of 0.039, whereas in case of the Turbo, the sentiment score was quite positive, which is a bit higher, which is 0.123, and the distribution was more varying in comparison to the old GPT model. And in case of when we analyze the emotion or the feelings and summarize them into like positive, neutral, and negative, it shows that in case of the GPT-4, the older one model, the majority of response were neutral with minimal negative emotions. Whereas in case of the new model, the majority were neutral, whereas the frequency of negative was quite like a bit more. As you can see that the red histogram is a bit larger than the other one. So from this, what we saw that the response generated by GPT when we analyzed the BLEU scores, it were varying from moderate. So the range was kind of a moderate. However, the response were in the GPT was highly skewed towards the 0, and in case of so the overall summary was like the response were distributed from moderate to low BLEU score, as well as similar pattern was seen in when analyzed the ROUGE scores. So this kind of shows still GPT lacks the depth and the empathy, the generation of empathetic response, which is crucial in mental health. So it's kind of lacking it. And when we analyze the sentiment, the response were neutral to slightly positive. So this shows that it's kind of suitable when it comes to providing mental health treatment, because those patients requires positive or slightly they don't want some kind of negative responses, like they can't handle those kind of things. And GPT So in overall, like it may have a potential benefit, but like we feel it requires further refinements. And one of the things that we lacked in this study was the generated response. Like we could not evaluate those generated response with the help of clinicians. If we could have achieved that, that would have been great. So that's one of our limitations. And so the final conclusion is when it comes to using these kind of large language model, especially like GPTs 4 and Turbo. GPT-4-Turbo is was better and more advanced than the older GPT when it comes to generating reflective response. So it can be a good way to experiment in clinic also. And similarly, the sentiment and emotion were neutral with positive inclinations, which shows that these kind of a model in future may be useful for providing counseling to the mental health patients. So in future we may see that doctors may be using these kind of tools, or like we as a people might be using these kind of tools to get counseling. And the third thing is so GPT-4 provided more varied and richer content in comparison to the GPT, the older GPT. So it shows that overall like the GPT is kind of improving itself when it comes to providing mental health treatment, and in future, like who knows, it may achieve great capabilities. That's all. Thank you.
Thank you for a great presentation. Do you have any? I would like to ask you about the sentiment and the emotional analytics. So I'm wondering that actually expert clinicians would score alongside the GPT and GPT-Turbo, right? Because you showed the GPT-4, GPT-4-Turbo, but I'm wondering where the expert clinician would place, the expert clinician answer would be placed on those graphs.
You mean to say like showing the expert clinician's graph in that plot?
Yeah, in the sentiment and the emotional analysis. Did you do that, or did you?
No, like we can do that in future, but right now we basically analyzed what were the sentiment of the generated response. We only focused on that. We can add a comparison with the reference text also. Yeah.
Thank you.
Thank you for a very interesting presentation. And undoubtedly, large language model will evolve, and eventually you will be able to come up with a perfect model for your question. But how do you think this can be implemented in a clinical practice? Is it more for patients to communicate with some chatbot, or for provider doing psychiatric evaluation? How do you envision eventual implementation in clinical practice?
I feel like the present context, because when it comes to the mental health, people try to keep those kind of things secret to them. So if we have like a better tools with whom we can interact and share our feelings and emotions, and if they like provide good response, human-centric response, and are of a quality, so people can use these kind of tools at their home. So we are kind of basically evaluating if GPTs are useful in providing counseling to the mental health patients. So it's just about evaluations, and I think if we have improvement in these tools, because people can easily access these kind of tools, and that's going to benefit a lot of people. They don't have to go to the clinicians, they don't have to like expose all their secret, they can maintain privacy and get whatever they want. So it's more about evaluations, but we don't want to integrate these kind of things, because those are not ethically and possible. This is kind of OpenAI is kind of a private company which is kind of taking data from the patients. So we don't have any plans to integrate in any of our healthcare infrastructure right now, but in future once we have open source model like more better models, then yeah, maybe.
Thank you.